And welcome back to the WHHI Daily News. It's time for the Mind Your Health segment with Dr. Debi Lynes. Hey, Debbie, I love the blue.
Well, you know, this
Easter egg blue.
Easter egg blue, and this is my Mind Your Health ensemble that I wear every time. You know what we're talking about today? I'm super excited.
ADHD, what it is not?
Well, okay, what it is not. We'll do that.
Okay.
So it's attention deficit hyperactivity disorder.
Okay.
So many people, adults and children, have it. Here's what it's not.
Okay.
It's not a disorder of focus. It's not a disorder of focus.
I thought it always was, that you can't, you're agitated and you can't focus. So
it's the opposite.
Okay.
It's really folks of attention deficit hyperactivity disorder are super focused in on what they love.
Yes.
Or what is new and novel. If they love video, because you hear it all the time, my kid paid 18 hours on the video game and he had 5 minutes of math homework and he couldn't do it.
Right.
Okay.
Right.
So it's really that he couldn't focus. He could focus.
Yes.
Okay. He just didn't really like math.
Right.
Okay. And that's not a bad or a good thing. It's the way these kids' brains are wired. So they're wired to really hone in and focus on things that they love, but really struggle to do that on things that they don't understand, are too difficult, are tough to navigate. And here's why. Because when we learn, don't you love it when you don't even have to ask a question?
Yeah. Because I'm just so mesmerized by it.
And here's why. Because when we read or we're doing math or we're interviewing someone, we have to pay attention. When we pay attention, our brains, I don't want to say they hurt, but they're activated. It's not passive. I can't just kind of lay back here and not pay attention. We're engaged.
Yeah. Yes.
And for kids, oftentimes, for some kids who have attention, or adults who have attention deficit hyperactivity disorder, that act of engaging is really uncomfortable at first. Because they'd rather be on the video game, right?
Right.
But if I can teach them and tell them, it's okay, if I can get you to engage for about 2 minutes, they go into that flow again. And for any of us, when we're learning, if we can learn that it's okay to recognize that we're going to feel a little uncomfortable for a minute or two when we start that new book. Have you ever had that happen when you're reading a book and you're like, I just can't get into it?
Right.
And then after about 10 pages, you're like, mesmerized by it.
So, Debbie, is there treatment for ADHD besides medicine?
Tons.
Okay.
And I will tell you that the way most any kind of disorders work is that it's a combination of a treatment, like a talk treatment or skills and strategy building, and medicine. The goal of medicine is always homeostasis. It's always balance.
Okay.
So if we could get the young man who has or young woman or old woman who has attention deficit hyperactivity balanced, okay, get their brain chemistry kind of where it needs to be, get the wiring doing what it needs to be, then I can begin to attack my skills and strategies and practice those. And then, then I really can live a rich and healthy life. So it's a combination of everything. We tell people all the time, because ADHD is a spectrum disorder, okay, it's on the spectrum. For some people, absolutely you do not need medicines.
Right.
Absolutely. Right. For other people further on the spectrum, it is advised that in order to achieve your full potential, 100% medicine. Because the two things about ADHD, you have the ability.
Yes.
Okay, and you have the intelligence. So you have the ability to do any and everything you want. You have the intelligence to do anything and everything you want. It's just a matter of putting that all together and making it work.
Right. And diagnosis is tough, isn't it, for ADHD, or is it not?
It's
probably a loaded question.
It's probably underdiagnosed.
Oh, okay.
To be honest with you, it's probably underdiagnosed, but it's really getting rid of the stigma around it and recognizing it's just a developmental disorder. It's just neurodivergent means I think a little bit differently than you.
Right.
There are neurotypical people, and that's the majority of people, but then there are neurodivergent people, and that's a few, that's less. But again, same intelligence, same ability, just different ways of getting to the end.
Very good. Very complex issue, very complex. And you did a nice job of kind of unraveling it for us.
We can pick apart those pieces at another time.
Drill down. Thank you, Dr. Debi Lynes, with your Mind Your Health segment, and we'll be right back with more news. Don't go away.